So we are at about 150 and wanted to give you all our full and undivided attention. So we'll get started. Start off with some introductions, some general overviews, and kind of the ultimate goal of what we're going to be presenting today. And with that, we are going to be doing some interactive pieces. So we would love to hear your voice, not just on certain sections. If you have questions, please put them out. We are here and happy to give some reflection back and figure out kind of what and how we can best answer, or maybe even the group can best answer your questions. So with that, I'll start off with some introductions, and how about we'll do ladies first. So Lisa and then Val, and then I'll finish it up.
Great. Good afternoon. My name is Lisa Snitzer, and I've been in the field of behavioral health for many years. I'm a program manager, I'm a consultant, and a Coach Approach trainer and Coach Approach affiliate, and I'm delighted to be here.
All right. Thank you, Lisa.
Hi, good afternoon. Welcome, everyone. I'm Valarie Oulds. I am with the Philadelphia Department of Behavioral Health and Intellectual Disability Services. Been there for about the past 14 years, with a focus on children and family services. I am also a Coach Approach trainer and affiliate member, and I'm also a family member. So this conference is near and dear to my heart. So it's good to be here.
Well, thank you, Valarie. My name is Mark Durgin. I am the project director for the Pennsylvania Care Partnership. We are the statewide system of care grant for Pennsylvania. So that is where I spend most of my time. The other it's probably getting a little bit more than a quarter of my work is also really devoted into the idea of coaching and leadership. As a associate partner, associate coach with the Coach Approach Partners, we are providing and really kind of integrating the Coach Approach model across Pennsylvania. And then ultimately, we're actually bringing this model with the work of Lisa and Val and some of our great partners with the Coach Approach partners to really bring this work across the country. As I kind of said a little bit earlier in our when we were welcoming people, if possible, we would love to see everybody's face for our trainings. It's one of the things that we really appreciate and focus on, especially when we're doing this virtual training, is being able to see people, because it's really that form of connection. And also really, and we'll talk a lot about this today, this idea of being present and being aware of what's happening and how we can support each other in those ways. So what we're going to really be talking about today is the Coach Approach to Adaptive Leadership. Some of the objectives that we're going to be focusing on is understanding the power of presence, how questions are so important in getting information, and also how questions are used in order to really help develop those around us. Also, how we are listening, how we are engaging, how we clarify and understand what's being said. So we're going to dive into that in what we call the Coach Approach skill sets. We're also going to kind of throughout this is really align this with the idea that the Coach Approach is system of care. In this idea that with Coach Approach, you are working with other people, you're bringing them into the conversation, you're bringing system partners, family members, youth, all together to really change the conversation, change how we are being, to really build each other up. Participants will also really learn about how the Coach Approach tool, the Coach Approach model, is a trauma-informed approach. Ironically, when we started this training, we really didn't have it developed as a trauma-informed model. And yet, as we've been teaching this for the past 3 years, we know that it is. We know that it is really about how we make people feel safe, feel seen and heard, and all of this is really wraps around this idea of trauma. So we'll do some general trauma overview and tie this into the Coach Approach model. And then ultimately, we'll do a little bit of dialogue on the Coach Approach, how we've evaluated it, and also how we had to transition. We transitioned pretty rapidly from a from a face-to-face, in-person, we call it square in your pair. I mean, getting knees to knees with somebody to have these dialogues and have these discussions, to this virtual world. And just noticing the doubt, the challenges that we were perceiving, and then also actually able to see some of the outcomes that we were able to capture when we switched to virtual. And just to put a little idea in there, we found that people can engage, connect, and be part of the training at the same level, even sometimes higher in a virtual world. And it's all through this idea of technology and communication. So in this approach, we like to say that everybody in this room is a leader. When we talk about this idea of leaders is not a position, a role, a title. We talk about this in the idea that in this coach approach mindset, we are all leaders. We all have value. We all have knowledge. We all have thoughts. And how we bring them forward is really this idea that we can lead from any chair. We can use our voice to empower others, to bring others to our tables, to bring others to greater accomplishments. And by using the coach approach model in this idea that we're leading from any chair, we're refraining from asking or answering questions. We really try not to answer questions in this model. The whole idea is that when people come to us with questions, we ask more questions and help that person to really develop and define where they are and what their goals are and how they want to move forward. So really being in that person and family centered, and really understanding the individual needs of each person. So we're going to kind of, in this training, we're going to go into a little bit of the mindset. We're going to talk a little bit about what coaching is, put you into some table groups. So we're going to have you talk to each other and engage each other and really learn from one another. And we're going to talk about the skill set and the mindset, why we do this, the how we do this in this training. And we're also going to we're going to tie it very closely into the trauma-informed piece. And we always like to start off with this idea of what is coaching. Coaching is not mentoring. When we look at mentoring, you're advising, you're telling, you're using that lived experience to mentor, to show the other people how to do things. Thinking of it in that kind of high fidelity wraparound world, you're doing for at that point. This idea of consulting. You're analyzing, you're looking at the future. The consultant is the expert. They're giving their knowledge to who they're hired by. Very good for certain things, but also not the most empowering to help those individuals develop their own choice, their own models, their own thoughts. We also look at this idea of therapy. The method there is kind of assessing and treating. You're understanding what's going on and you're treating a specific problem. A lot of times you might be looking at the past. The therapist has a great deal of knowledge and uses that knowledge to help bring this person around and provide them the support and treatment that they need. The therapist, the expert. The therapist actually can hold a lot of power there. We're seeing some change in that as we become more person-centered, but the reality is the therapist has a lot of power. When we look at coaching, the method is fully empowering. It is fully about how we bring this other person to really understand and make the decisions. The empowering is not us telling them what to do. The empowering is us supporting them. When we look at coaching, we're really looking at the here and now. And another interesting thing that we'll go into, we're looking at the present, and we coach the person and not the problem. We'll dive into that a little bit more. Coach the person and not the problem. Who's the expert? The expert is the coachee or the person that is being coached. They know the answer. We believe that. And who holds the power? Who holds the direction of where the conversation goes? The coachee. that person being coached. The coach is there kind of as a facilitator, a vessel to bring where this person, all their skills or knowledge to bring it out. So, Lisa, I think it was you.
Yep. So the use of the coach approach to adaptive leadership. We're also saying that this can be used in your personal life as well as in your work world. And as Mark shared, we're all leaders. So it doesn't matter where you are positionally, you are a leader. And in this approach, really our goal is to build critical thinking. And that's why we're asking more questions and giving less direction in general, unless there is one specific answer to a question. Then, of course, we can give that. But our goal is to help build critical thinking. We're focused on the strength and the skill development over time, the people we work with, for our family members, our loved ones, and in addition to the day-to-day instruction and oversight, if we're in a power position of leadership in our work world, or perhaps as a parent. So we're offering more affirming and grounded assessment and feedback with the intention of strengthening somebody's skills, helping them to identify opportunities for developmental improvement. Again, developing strategies to empower. We're not the experts. Can you shift, Mark? So using a trauma-informed lens, and it's the lens of all of the work that we do. What we're saying in our coaching approach, that how we listen and how we are present is informed. We're taking into consideration the culture and history, the impact of trauma, the perception of trauma, using that lens and how we see the world around us and perceive the actions of others, and how important safety is. Everything we know about trauma and the impact of trauma. Feeling safe, feeling seen, being heard is paramount to moving forward. So trauma impacts each of us differently, and effective coaching means we are trauma aware. We are there with the person wherever they are. The goal is to help folks have choice, autonomy, be masters of themselves. And we know that trauma is, the latest that we have seen is 1 in 5 individuals have experienced some form of trauma. So we assume, both for ourselves and for the people that we're with, great likelihood that there have been some experiences of trauma. Mark? So what we're saying about the coach approach is that this model offers a way to support others while tending to ourselves. So the impact of helping others through a coach approach lens can be very rewarding. Supporting others' dialogue and the belief that they know what they need to do. We can feel that. And yet, helping others can be very stressful. And stress can result from our work with families, with systems, with providers, with our own families, in our own homes, in our own communities, and maintaining and understanding our own emotions, being able to manage our own emotions so that we can be present for people is a piece of what we're talking about with a coach approach. So it's not just directed outward, but how we take care of ourselves. We recognize that we need to, the demands of the work are such that we need to maintain a work-life balance. And in order to be present for people, we need to be present for ourselves.
So I'm going to do a bit of a refresher on, the term of trauma. What is trauma? So Samson's definition reads, individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or threatening, and that has lasting adverse effects on the individual's functioning and physical, social, emotional, or spiritual well-being. So that's their definition, and one that probably many of you are familiar with. And SAMHSA has taken from that what they're calling the key principles of having a trauma-informed approach. And there are 6 of those. The first being safety. Another is trustworthiness, transparency, that the person feels that they can trust the person in that space, and that person is being fully open and transparent. Peer support is also part of a trauma-informed approach, the work that many of you here do. Collaboration and mutuality. It's really about a partnership. Empowerment, voice and choice. Again, we've mentioned this previously around the coach approach. Empowerment, voice and choice, and being seen and being heard. And cultural, historical, and gender issues. Seeing the person as a whole, their whole being. And as you will see, coach approach embodies these principles. Next slide, please. In this field of family support, these 2 are particularly relevant, I think. And they speak to types of vicarious trauma. One is compassion fatigue, where it's characterized by this emotional, even physical feeling of exhaustion, and leads to a reduced ability to empathize or feel compassion for others, sometimes referred to as secondary traumatic stress. And empathy fatigue, similar, brings about this feeling of detachment, emotional detachment, from prolonged emotional exposure to situation. And as it says here, it is in fact what causes the fatigue and burnout that many caregivers experience. And again, most of the folks here, in one way or another, are caregivers and are supporting caregivers. So these, I think, are particularly relevant. Next slide. Lisa.
I'm going to take this one. All right. So we want to actually just give this brief video. I just noticed it's a little bit small, so I'm going to do something here real quick while we're setting this up. So we want to just watch this kind of brief video on just a little bit more definition, a little bit more defining of trauma, and also really how the brain works. So it's about 2 minutes and 45 seconds. So we will get this started for you. See if that'll work. Oh.
So I want to talk for a minute about how to teach the brain. One of the really important things that we know in trauma So I want to talk for a minute about how to teach the brain. One of the really important things that we know in trauma is that when we help people understand the injury trauma creates in the brain and help them understand how that impacts the way they respond to other events in the world, it really helps them and their families move forward in their healing. So lots of people have given ways to teach the brain. As a practitioner myself, I've taken a lot of the models from Dr. Dan Siegel, taken models from the Hahn Foundation for teaching in the optimistic classroom and looking at some of the things Ledoux has done and put them together and really challenged myself and folks that I educate about practicing really teaching the brain. So when I explain this to teenagers, I start with the hand model, okay? And I start by explaining that we're going to talk about the downstairs brain and the upstairs brain that everyone has. Formally, this is called the limbic system, and this is called the cerebral cortex. But what we're going to talk is downstairs brain and upstairs brain. So in your downstairs brain, this is where fight, flight, or freeze lives, okay? When threat comes at you, your body has 3 reactions it can make. It can fight, it can run away, or it can stay very still until the danger's gone. That's what this brain does, okay? This part of the brain. What's up here, the upstairs brain, its job, among many other things, is to solve problems, to help you calm down, solve problems, okay? And to tell the downstairs brain, I got this. We're gonna be okay. There's another solution. So what happens a lot of times to kids who've experienced trauma is if you think about these like muscles, because you've gone through a lot of threat, this downstairs part of the brain's been doing push-ups your whole life, okay? So this part of the brain's really strong. The part of your brain that solves problems hasn't had as much exercise because you've had to be really strong to be a survivor, a thriver. So what happens is that the brain gets what I call emotionally hijacked. This downstairs brain comes up on top of this brain, it takes over, okay? So the downstairs brain's in control. And so you fight, you run, you freeze. The only things that work when you're down here are things that calm you down. So they call them self-regulation skills. And that happens from connection. Somebody talking to you, helping you breathe, helping you feel your body calm down. Once that happens, then the upstairs brain can come back, and then you can solve problems. So that's how I try to explain to teenagers the downstairs brain and the upstairs brain, and what happens to them when they experience a threat.
So with that, just want to kind of put a couple of key points out in this from this video, and would love if there's any kind of reflection. We're going to go into a table group in actually just a minute to have a little bit more defined reflection on this. What we really want to think about in this is, and we're going to talk about this a little bit more, we are as humans wired for threat. The idea that trauma does impact us, each and every single one of us, in very different ways. When we really talk about being trauma aware in coaching, or in this coach approach model, we are really working to get people from that downstairs brain or that limbic brain, that reactionary piece, to get them calm, centered, present, to get them back into that upper or the limbic system, to get that piece working again, to get them thinking and understanding and really diving into this work and this way of communicating. And really what we're going to also talk about in this idea of coaching is how we connect. How we connect with one another is so important.
With young children.
Oh, okay. So the other piece that we're going to talk, that I wanted to just bring up as we are looking at this idea of trauma, and we're going to be connecting this throughout the training. Many of you are probably aware of the ACEs, or the adverse childhood experiences, and some of the implications. What the ACEs studies have shown is that nearly 2/3 or 64% of adults have at least one ACE. And these ACEs are things that are happening to many of us. And it's about how our resiliency, our coping, and a lot of other factors that help us get to either a state of working through our trauma or sitting in it. When we look at ACEs, they're responsible for a lot of challenges: workplace absenteeism, healthcare, emergency costs, mental health, and criminal justice. What we really want to kind of focus on is the experiences we have impact how we see the world around us. And we're going to talk a little bit more about that as we move through, as well as this idea that coaching does not address trauma from a clinical approach. And we want to be very specific in this. This idea of the coach approach model is not a clinical. It's not a clinician. It's not treating trauma. We're just working to be trauma aware in our conversations. And coaching is really about being present and supporting those around us. As leaders, we have this ultimate responsibility to acknowledge the experience of others, to understand the experience of others, and to help others grow. So we wanted to offer to go into a couple of table groups. I think we have about 5 or 4 that are going to be set up. I'm going to send you in for about 7 minutes, and we really want you to take time to talk to each other about how this work, and how the trauma awareness, the way that we're seeing the world right now, how does this relate to your work at home, your work in the community? How does this relate to where you are in this world? So with that, Lisa or Valentin, if you had any additional comments or thoughts as we get kind of people set up into the rooms.
I just want to share that Mark is going to be placing each one of you in a table group. I guess there are going to be about 5 people in a table group. So in a minute, you'll be whisked off. You don't need to do anything. But if you're having some problems with technology, you can leave the table group and come back, and Mark will help you get back in. When you're in your table groups, it's really helpful if you can share your face and your voice in the room. If you can't, that's fine. The people that are in there with you, if you chat, they'll be able to read it. And after about 7 minutes, automatically, you're going to be whisked back into this room. You don't have to do anything, and we'll continue with a conversation and the training. And I can see that there's at least one person that can't unmute. Adrian, that's okay. If there's something you'd like to share, we can read in the text. Yes, I'm sorry, in the chat. We can read. Any other questions about this process?
Take some time.
Just a clarifying question. Yep. Can I ask one question? So are we talking about how this is relating to our work at home environments, about the trauma that we see in the world today, about what's going on in the world? It's not about the coach approach, correct?
Correct. Yep. Yeah. Just kind of how trauma is really affecting the work that you're doing. Great clarifying question. All right. So we'll open this up and we'll see you just in a couple minutes. It's moving over.
It looks like there's a couple people there.
Yeah. Val, did I answer your question earlier?
Yeah, you did.
Okay.
Yep. Thanks for that. Yeah.
It looks like Celeste is having trouble. And Jan, maybe?
I don't know.
You're hard to hear, Lisa, all of a sudden. Like you're very low.
Okay.
Ah, much better.
Just could be in that little limbo world. There it is.
All right.
Hi, Amanda. We're actually we're in a quick breakout room, and we'll send you into one of the rooms just to, actually, you're already in a room, it looks like. You're on 2 lines, so let me put you in.
Oh, I got disconnected and I reconnected. I don't know what happened. Sorry.
All right, yep, you're good. I'll put you back in because it's showing you in there still.
Thanks.
That was weird.
Really difficult to not see people.
Yep. We'll survive. I did see someone put in chat that that was one of their favorite videos explaining
Yeah.
Mhm.
trauma.
I think that was Terry from AFN.
Right, so here's somebody else that bumped back.
Yeah. I think, Adrian, you were in one. Yeah, okay. I'll move you back in there. I gotta learn to get a picture. Oh, little note for the future there.
Is that Pat Mosby? So Pat is not in a room.
Oh, I'll just go to.
Pat, if you're just joining us, and it's good to see you,
Oh.
people are in table groups.
So one of the challenges with table groups.
Did she just come into the meeting?
I think so.
Because I didn't see her name earlier. I know her from Maryland. So our first break, we had said possibly after.
Yeah, I think that we could probably do it. It would almost make sense to almost do after, get a couple, see if we can get a couple of reflections back, do the Victor and then the break.
Seems a little teeny bit early to me. I think, well, we'll see how many reflections there are. At
Mhm.
2:45, we'll be in an hour. So I think we
Oh,
need
that's
to,
right. We started at 2:45, not 2:30.
Oh,
yeah, I think we need to, I think we need to push this to an hour before a break.
Yeah, I thought for some reason.
all
we
right.
started at
So
2:30.
2:45-ish.
Yeah, yeah. Otherwise, the second bit will be too long.
Yep.
So maybe we'll see how it goes.
Well, if we can, I think we'll be able to get through in summary before the skill sets.
In summary.
Yeah, that'll be, well, at least we'll get through most of it. Depends. Hopefully we'll get some questions.
Which slide is that?
Oh, it's gonna be
What, 21?
23.
Oh, yeah, 23. Here it is. Mhm.
My numbers, I printed this out a version before, so my numbers aren't.
Oh yeah.
Yeah. Yep.
Black and white. Color ink is insanely expensive.
Mm-hmm.
It is.
53 seconds, and I'm gonna do welcome back, Cotter. I'm going to mute because my dog is yelling.
Welcome back. Your dreams were your ticket out. Welcome back to that same old place that you laughed about. Well, the names have all changed since you hung around, but those dreams have remained and they've turned around. Who'd have thought they'd lead you? Who'd have thought they'd lead you? Here where we need you. Here where we need you. Yeah, we tease him a lot, 'cause we got him on the spot. Welcome back. Welcome back. Welcome back. Welcome back. Welcome back. Welcome back. Welcome back.
Cute song.
Welcome back. It's lovely to see your faces, even if they're little squares. Really nice to see you all. So just take a couple minutes and invite you to share your reflections from your group. A couple folks would like to share, and you can just unmute yourself and speak into the room if you'd like, or if you don't have access and you'd rather chat, we can do that as well. How was that?
I'll share. So we talked about the surge in mental health issues with families because of the environment that we're living in. And so that also caused the lack of resources. So there was a lot of discouragement about not being able to give the resources to families that they need. And we also discussed when family members go into crisis and they have to go to the hospital, they don't get the help that they need. They're sent home, or families need to even wait in the emergency room. One example was a family who had to wait 2 days in the emergency room. And then grieving is different, because it's been 2 years, if we've lost someone we loved or needed to grieve about something, we don't have that greater community that we can go and hug and comfort each other. And also there was the discussion about not being able to help others through that process as well, being able to be with them and help them through their grieving. And then we've got Brock back here.
Thank you. Very, very meaningful. All true. A lot of the struggles of what's happening now.
Yeah, Lori, can I ask a follow-up question or just a point of clarification? It sounded like a lot of what your group was talking about, with being in the hospital and it almost felt like not being seen or heard, and even with this idea of grieving and with all the things that are happening in the community, I'm feeling this idea of connection is a challenge.
Right. That's a great way to sum it up. I like that. Thanks, Mark.
I saw Celia
Did
nodding.
anyone else agree with what Mark's summary that was in the group?
I agree. Yeah, I think it's important when that's a buzzword, right? Connection. Like, how can we connect our families to the appropriate resources? How can we connect our families to the appropriate point person so they, don't feel like they're getting the runaround from the different agencies, the local agencies that we work with. No, I think that was spot on, Mark. Thank you so much for clarifying or for throwing that out there.
Yeah. Some other reflections.
Hi, it's Tammy. I'll go from our group. First of all, I think we were a little taken back because I was expecting someone from the group, was one of your facilitators, to come in and run it. We didn't, so there was a pause of time until we realized, oh, it's us. And then we just kind of jumped up and decided who was going to lead or whatever and go on. So with that said, we took a few minutes to get to know one another, which I love. Okay. So, but I think there was Jen and Elizabeth from Maine, which, we talked about that a little bit, which I love, but their roles, and Jen had spoken a little bit. And Jen, jump in here if I'm wrong, because I didn't start writing stuff down until thinking, oh, we might have to tell a report here. So Jen talked a little bit about, I guess, working with the family she serves, and how the trauma affects them. And Jenna, you could clarify the details of that, please. But I did want to mention that Celeste talked about how she's in drug and alcohol and mental health as a peer support. Again, correct me if I'm wrong, but I wrote down something she said, which stuck with me. She said, you know, when the children or the youth that are with the families, and so many people will talk about, families will say, or even the system will say that, you know, that they happen to be brainwashed to believe that trauma is normal. You know, it happens so much that it's all like, well, they're just a teenager. No, they're experiencing this behavior because of the trauma. There's more to it, you know, and that resonates with me because I hear that a lot, even with my own children. So, and then we're back. So I wish there was more time, but moving forward, we'll hopefully get to know each other, should I say, in this format. It is hard when there's so many.
Mhm.
You brought up one really beautiful point, which is you were expecting somebody else to come in and lead. And, you know, what we're saying is that you're all leaders. You're all leaders. You know this. You know this work. And you know actually how to do the coach approach. We're putting a framework around it, but you're already doing much of this already. And you're already leaders. All of you. So good for you. Just grabbed a hold of it. One other thought or reflection.
Hi, my name
Hi.
is Celeste. I'm from Susquehanna County, Pennsylvania.
Hey.
I just wanted to reiterate real quick. First of all, I'm really excited about this. Thank you, Mark, and everybody that's bringing this to us. I had no clue. I'm learning, and this is great. But they just discussed a little earlier about, you know, getting the families acknowledged and getting them to the resources. I personally just went through this a week and a half ago with my granddaughter, who's 17. We sat in a hallway in an emergency room. My daughter was back there with her for hours. It was 16 and a half hours. She wasn't offered a cup of water. She wasn't acknowledged. When they walked past my daughter, they turned the other way. And there was several. There was as young as a 9-year-old young boy in there down the hall from her, in the hallway, laying there like it's like a staging area, I said about it. So I asked to switch spots with my daughter, and I went in and I observed, and I was listening to the workers behind that wonderful nurses station, which, listen, I did nursing myself. I get it, but we hear what they're saying. So I got a hold of 2 nurses were coming down the hallway, and one said, unbelievable, you know, and I said, I'll tell you what's unbelievable. And I said, these kids here in this hallway, laying here, one laid in her own vomit for 2.5 hours. This is real life nightmarish stuff. And so I went on a little bit, and then I said, excuse me. And I noticed the one tag was the head nurse. I said, excuse me, allow me to introduce myself. So I said, I'm Celeste Kranick. I'm a mental health first aid. And it was like deer in the headlights. She just stopped and looked. I said, this is unacceptable. This is what's unbelievable. There has been nobody, no delegate, nobody came down to assure these family members what the plan was, that their loved ones are being taken care of. The nurses didn't offer a bottle of water, a meal, nothing. So that's why I said later on when I went out to my car, because I slept in my car for 2 nights, thinking it's almost as if it's a staging area between the medical, physical medical, to the mental medical. And I don't know if this happens all across the country, but it has to stop and change. That's all I have to say. Getting these patients acknowledged in the ER is what is really important at the first step. Make them feel comfortable they're going to get the help they want.
What you're talking about in part is that this is a broken system. It is a system that is not always helping the people that are asking for help, and how frustrating that is, and how frustrating that is for us, right?
Right.
How painful it is for us.
Very painful.
So Viktor Frankl is a eminent psychiatrist and researcher, and he's a Holocaust survivor. What he said, I think, actually relates very much to all the things that you shared today. He says, between stimulus, what happens, and response, our response, there's a space. In that space is our power to choose our response. In our response lies our growth and our freedom. What the coach approach can provide is a framework for being present and able to choose our responses. And that's what a lot of you are speaking to. The systems that don't work, the people that are getting hurt. I'm sure there's another workshop out there around advocacy. We can all join that. But this is about what we can do and our response, our human response. Thank you for sharing. So here's a comment from another group. Our group talked about the isolation and lack of trust because families, hold on a second, because families are not sure what will happen next. School in one day and the next day the kids are home. Right. It's completely volatile and unpredictable, our environment.
We have a term for that. It's called VUCA, and we'll show you what that is.
Thank you. Thank you for sharing.
So I'm going to now walk us through what we call the coach approach skill set. And as you'll see, the first thing, very top, is presence and centering. And it's how we show up present and a way to establish that connection that people are talking about that we need. So the person feels seen and heard. Engaged listening is another skill set. You know, how are we really hearing what the person is saying? Clarifying and reflecting is the third. And that's a skill that enables us to make sure we truly understand what the person is telling us. Inquiry is about curiosity. It's about asking good questions that really help the individual to get to the core of whatever the solution is that they're looking for. Collaborative feedback. And so that's where we offer mostly positive feedback in order to build competence and confidence. Anchoring accountability is around establishing that this is the plan, this is what will happen, and who is responsible for what, right? If it's a supervisor, employee, staff person relationship, you know, each person will have some accountability to the other. And the other, at the other bookend, as I call it, of presence and centering is modeling behavior. You know, how we show up with others really sets the tone for, you know, how we want that relationship to be, how we want others to show up as well. Next. All right. So in addition to the skill set, there's what we call the coach approach mindset. And we believe, you know, first here, that we believe others are capable and competent. So to the point where, you know, someone thought we were going to show up in the breakout session, we knew you were capable and competent. You'd figure it out, and you did. Another piece of our mindset is our role as leaders is around strengthening others and building their skills. Because when you think about it, your team is strong, and we are too. We're all strong when we're strong together. We also believe that there's more than one right answer. Now, there are going to be some situations where there's only one Right answer, right? Like, what is that round yellow ball in the sky? Okay, it's the sun. However, most questions and issues that arise in the kind of complex world we live in, there's not just one answer. So it's getting to what is that answer for that person. And we support critical thinking by asking questions. I talked about the skill set of inquiry, and that's around helping people to develop their own solutions. And we also believe that no one is above or beneath getting support. Doesn't matter at what level you are in your organization or in your group. And no one really has to be an expert to offer good trauma-informed support by using the coach approach. We also show up with cultural humility. And we are supportive and believe in other people's ability to be resilient in the face of whatever it is that may be happening. So setting the context, and I'll start around brain science. And don't worry, this won't be like a biology section. But the brain science has told us a few things. One is, we all want to feel safe, seen, and heard. That's just how we're wired. We all want a sense of control. We all want a sense of certainty. And we also want to see situations as fair. We all want to be treated fairly.
So this is where things get a little bit complicated from that idea that we all want to, we want to have this sense of safety and being seen and heard. One of the biggest or largest challenges we have in life is we are hardwired to imagine threat, especially when things are more stressful. We're hardwired to see or to think about the worst of a situation. How many of us have gotten a call from the school? It says, hey, I'm calling about Sean. Can you call me back? Or calling about your child, can you call me back? Quick question for the group. What comes to your mind when the school calls automatically?
That there's a problem, my child was acting out, my child's in trouble, maybe in the principal's office.
Yep.
Somebody's hurt.
Yeah, somebody's hurt. Bad news. So when you call back, where are you? Where are you coming into that conversation? Automatically.
On 10.
On 10, tense. I'm going to defend my child. Yeah.
We know they're not calling us for a compliment.
Can I challenge you on that? You assume they're not calling you.
Yes. Yes.
Yeah.
We're going to talk about that. And Miss Harper, and I can't, your first name is eluding me.
Tammy. I'm
Tammy,
sorry.
thank you.
That's all right. So I was going to say sometimes my daughter's part of her, my one child with mental health is it's medical as well with her seizures. Her behaviors goes hand in hand, should I say, with her expecting a seizure. She'll go into a behavior, or maybe it's coming on and she'll go into a behavior, or she go into a behavior because of the seizure, or she's going to a behavior because she's a fear of a seizure. So it's a seizure disorder. So we're constantly getting calls about possible seizure, may have been a seizure, a fake. She fakes for the attention. She has a lot of intellectual issues as well. So, which is because of many seizures, it goes all, it's just, a merry-go-round,
Yeah, absolutely. So how we want to change the conversation is because we know people are hardwired to imagine sometimes the worst, we need to provide those other people, the people that we're trying to engage, that we're trying to work with, this idea of being safe, seen, and heard. We do this by giving the information, by providing what they need with enough information to move things along. We'll talk a little bit more about that as well. So this is called the SCARF model. It's developed by David Rock of the Neuroscience Institute, Neurologic Institute, neuroscience or neurologic. I'll get it. But David Rock is his name. So SCARF is a model that was developed from him very much in the idea of brain science. What the SCARF model looks at is it acknowledges that we are wired for threats and rewards. And when we think of the threats and rewards, he breaks it down into these 5 categories. This idea of status, how we imagine other people see us and value us in the world. This idea of certainty, how confident are we in the future? And where do we imagine ourselves in this? This idea of autonomy, how exactly do we influence or control ourselves? And where is it that we are guiding ourselves versus everything is being told and directed to us? This idea of being related, how we are connecting and feel connected to other people. So I love breakout rooms, and especially doing them very random. You're meeting people from all over. You're building new relationships. And then this idea of fairness, how we feel we're being treated compared to others. The interesting thing with status and this idea of SCARF, we call it when something happens in that idea of SCARF. So our status is lowered, we're ignored. We don't feel that we have this relatedness with others. We call this getting a snag in your scarf. We also look at this in a sense of SCARF is not always positive. Think of this idea of certainty. Real quick story. Was working with a client, and this client was doing some coaching work with the person. They were about to get a promotion for a new job. They were going to be buying a house and looking at some future relationships with their partner, where that was going to go. We hadn't talked for a couple of weeks, and she was very hung up on this unknown of the future. We checked in about 2 weeks later, said, how are things going? She said, well, I have certainty. Like, that's good. She's like, it's not great news, but I have certainty. I got laid off from my job. My partner left me, and now I have to find a house. So how are you holding up? She's like, good. I kind of looked at her. I'm like, tell me more. I needed to know where my future was. And I was sitting on all of this stuff that was in all of the unknown. I at least now have certainty about where I'm sitting in this world. And for her, that was what was needed. So certainty is not always the positive. And when we think about certainty and how we communicate, how many other people come to us with questions? Hey, what's going on with this policy? What's going on with this? And we don't know. We can still provide certainty even if we don't know. And we'll talk a little bit about that as well. So the other piece that we talked about, which I'm going to hand it over to Lisa to do our VUCA reality.
So we talk about the brain science. We talk about our biology. You know, we're wired. Saber-toothed tiger is going to come and get us. And so we're instantly in fight, flight, or freeze. We don't even think about it. It just happens like that. And then we find that the SCARF model influences us, what it is we're responding to. Here's the thing. The world is chaotic, completely chaotic. So the U.S. Army War College, you know them, They came up with this phrase and this term that I think we all talked about earlier in those groups. So the world really is volatile. Things change with lightning speed. Here we are in the time of COVID, and look at all of what has happened. There's complete uncertainty, lack of predictability in the world. We don't know what is going to happen next. We've been living with this now, just in these past few years, how much uncertainty and volatility has there been? And complexity. The world is very complex. Multiple and often competing forces at play all the time. And remember, through SCARF, what we're looking for is certainty, but the world isn't certain. And the world is ambiguous. Haziness, mixed meanings, mixed messages. This is what the world really is. It's unknowable and ever changing. So what we're saying is that the coach approach is here to help people thrive in the VUCA world. Thrive in the VUCA world of unknowing. And our role as a coach or as a leader is to support people, to be present, to manage their emotions, to manage our emotions, make our own decisions. And yet there's more. Mark, if you could move on. So there's another mechanism that's at play for us. Chris, I'm just going to say Chris.
Chris Rogeri's.
Dr. Chris developed this through Harvard. And what he is saying is that when something happens, we make assumptions. There's so much data for us to absorb that we make judgments based on our previous experience. We make judgments. And they come from the lens that we have, how we've experienced the world. Very quick to make decisions. They're like snap decisions. And they're not based on all of the data. They're just based on an assumption. It's called the ladder of inference. So what this means is that we're going to fill in the blanks with negative thoughts. We tend to put negative thoughts in place and draw conclusions, even if we don't have all the information. So you get an email or a phone call from your boss Friday, late in the day. Can you come and see me? What's the first thing that you do? Friday afternoon, my boss needs me. Most of us, I'd ask you to raise your hand if I could see you, but I'd say, how many of you would assume the worst? I bet you many people would raise their hand. But that may not be true. The ladder of inference is when we make an assumption based on a little bit of information and we fill in the rest. And we tend to fill in the rest with something that is negative. I see that's Tammy saying that was the old me. So our hope in the coach approach is that what we do is that we learn to pause and help the people that we're working with, or our family members or our loved ones, help them to pause and to ask ourselves, might there be something else? Might there be other explanations?
And Lisa, can I just add, it's also about where we're seeing it in ourselves. So when we're jumping to that conclusion, do we have all of the data? Do we have all of the information? And how do we take that step back to say, I need more?
Can I make a comment?
Please.
Sorry, I'm moving. I got all these screens going on here. So it's funny you said pause, because for a long time, well, we know a lot of people, especially the youth, well, anyone, they react right away, right? They're not thinking, they react to one little thing based on what you're teaching right now.
Right.
Again, the old me, for the longest time, I had little sticky notes everywhere saying, pause, take time, stop, think before you speak, reflect. Is there truth in this? You know, and the reality of, like you said a very, very well about, is there, the data, is this what you're all thinking, way of thinking, or is this really what's happening? So I have little stickies, pause. Pause and wait.
Beautiful, a beautiful teaching too for others. So we'll just do a little summary and then we're going to take a break. Don't worry, folks. We're going to take a break after this.
It's something from you.
Sorry, was that?
I think it was someone unmuted.
Okay, super. So to summarize what we've just gone through, we're talking about our biology. We're wired to see threat and we imagine the worst in order to protect ourselves. And this comes from our mammalian brain. This comes way, way back. We don't have control over this one. Our startle reflex. So we interpret modern threats through SCARF, through fairness, through affiliation, through certainty. We interpret the modern threats through that lens. And we quickly jump to assume danger and the negative. We just jump right there. Truth is that the world is unknowable and it's ever changing. I don't need to tell you that. You know that. So what we're saying with a coach approach lens is that as leaders, which we all are, we need to be adaptive, responsive, curious, wondering, willing to explore and to find out the best way forward. There is no one answer. And we need to help others feel supported, safe, seen, and heard. So we're going to take a little break. Mark, how much time do we have for a break? You're on mute.
Yep, just figuring that out. Let's come back at 3. I'm gonna make it an odd one for you all. 3:14, and I'll actually have a little timer up for you, so you can see when we're coming back.
Sure. So go take care of yourselves. Take a little break, a 14-minute break, 15-minute break, and we'll see you right back. Right.
lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on. Please
All right.
swallow your
So welcome back.
pride if I have failed.
Welcome back all.
All right. You take it from here. Welcome back, everyone. Hope you enjoyed your break. And I see this last song was Michelle's favorite song. I really love this song too. Now we're going to talk about one of the core skill sets, which is was the first one, if you'll recall the list of skills, which is being present. How do you become present and stay present? Now, I'll say, I don't meditate. You may be saying that to yourself as well. Well, I don't meditate, so, I don't know if I can do this. And it's much more than that, which we're going to step into in a few moments. Now, when you look at this slide, mindful or mindful. Show of hands, who relates more to the woman's bubble than that of the dog on the wall? Okay, yep. I would say that's most of us. I know it's me oftentimes, right? We wish we could be the little dog and just be so present, just looking at the trees and focusing on the beautiful day in the park. And recognizing this, this goes back to the brain science piece as well. Our brains are always thinking about the next thing to do and what is it that's triggering us and the like. So Terry's saying, I cannot fit anything else in there. Yeah, sometimes. Yeah, it's like full brain. So one of the ways to be more like our four-legged friend on the right, when we are especially entering into a space with another person to communicate and have that coach approach conversation, is to establish presence. And it really is the most important part of coach approach. And especially in spaces and places where we really need to be intentional about how we're showing up and how we're paying attention and tuning in. This is true as to meetings in person or online. Keeping our attention and our presence. And it also includes noticing when we aren't present. And then once we notice that, coming back into that place of presence. And it's really about self-awareness as I think about it. Being able to notice is the first step, to notice that you're not paying attention, which then, you're like, oh, okay. And then you take yourself back. And with practice, it really becomes much easier to do over time. Oh, Elizabeth, you raised your hand. Elizabeth?
Just in response to relating to the woman's brain.
Oh, the woman's brain. So was that a comment that I'm probably missed?
No, the mindful picture.
Oh, the woman's brain. Okay, I thought you were saying women's brains have more in it, which is a whole nother topic. So we won't go there. Anyway.
I have a comment.
Yes.
If you're entertaining comments.
Yes.
I like the part about noticing when we're not present, because I'm a very visual person. I learn by reading, and this is a very difficult thing for me to do. And I notice often that I'm not present, and I often have to recenter myself. So any tips you have on that for people who are visuals, that would be amazing. Or, any suggestions from anybody. Maybe they've experienced the same thing that I do.
I'll put it in the chat.
Okay, thanks.
Put it in the room.
Yeah, what?
Oh, okay. Well, I was just going to say I'm the same way. I learned so many different ways. And so one may think I'm not paying attention. It's kind of like the youth can text and hear you at the same time. I will write notes down. I'll do something else, and I can fully take in what you're saying, responding, and then trying to be present so everyone acknowledges that I am present. It just may not be what you think, that you expect of me. It's a learning style, I guess.
Okay. All right. So you're present by doing that. Okay.
Notes are really
helped me
beneficial for me.
It helped me when I heard the phrase of listen first for understanding and then to respond. So instead of trying to think of my response, which helps me to drift off, I really try to understand what that person is saying. So it keeps my mind focused on that person and not what I want to say to them when they get through. As soon as they get through, I'm going to tell them X, Y, and Z. I'm trying to understand what they're saying so my mind stays focused. Because I'm like her, I would wander off kind of, and I miss half of the conversation until I heard that phrase. And I can't remember what teachings I heard it from, but it just kind of stuck with me.
Can you repeat the phrase, Andrea?
Listen first for understanding and then for response.
Beautiful.
Thank
and
you.
then what we teach our workers, family support partners, and family navigators is reflective listening.
Yes.
So instead of focusing on yourself, you're thinking, am I understanding and actively listening to what is being told to me, and then reflecting it back to see if it's correct. So it kind of moves you from centering on yourself to centering on the other person.
Yeah, I will write down a few key words so I remember, because in the past I would say, well, I have to respond because I'll forget what I have to say. Well, it's not about me again, but if they need that acknowledgement of something after that reflective listening, then I can go back and and speak out what I wrote down. And
I think sometimes it's helpful to tell the person sometimes how your process, because if they can misinterpret it, like you said, thinking when you go down and write, you're not paying attention. And so you can, if you verbally say that to them, that I'm taking notes here so I can make sure I get the key points that you're telling me, then that kind of lets them understand your process.
These are all excellent points. And it happens to all of us. We're listening, and we're going to get more into listening later around, like, what are our tendencies? What are the habits we have at times when we are supposed to be paying attention and listening to someone? So you all are already ahead of the game here. So excellent points, though. Excellent.
And Val, before we jump into the presence practice, I wanted to just put two kind of thoughts out there, because Lori and some of the others that kind of talked about the challenge of being present. I'll be a little self-reflective here as someone with profound ADHD. When I started doing this, I couldn't sit for 3 minutes, for 2 minutes, and just calm myself. Presence practice is a muscle. It's a muscle that we have to work to really understand it and to start to notice it in ourselves. And it's also about forgiving ourselves when we fall out of presence, when we're not there. How do we just allow ourselves? I wasn't there. Now I am. Let's move forward. So just forgiving ourselves. and just understanding that it's part of who we are.
Well, do you have a recommendation for a book that has, how do you exercise that muscle?
That is a fantastic question and a great transition, because Val is going to help us practice that muscle right now.
All right, so I'm going to invite you all to get comfortable in your seat, a chair, wherever you are sitting, and close your eyes or lower your gaze. And we're going to take some deep breaths in and out. We're going to take a deep breath in through our nose and release slowly through our mouth. And breathe in again, nose, and out through your mouth slowly. And continue breathing in that way, in deeply, out slowly. And as you do so, bring your attention to your feet. Feel how they are supported by the floor or the ground beneath you. Notice your legs, thighs, your torso. Feel them relax. Continue to breathe in and out. Feel how the chair is supporting you, your weight. Let yourself fall softly into that chair or seat. And continue to breathe in and out. And as you are doing your exhale, let go of any thoughts, concerns that are in your mind about to-dos, what awaits. Notice them and let them go. And I'm going to ask you to take in one more deep breath in and hold it for 1, 2, 3, and release slowly. And this time, relax your neck. However, feel the stretch in your neck. Lower and drop your shoulders. And when you're ready, I invite you back into this space to go. How was that for folks? Okay, Celeste says thumbs up. Celia's thumbs up. You notice any difference about your being now that you're back in this space? Elizabeth, a hand up. Oh, I'm just looking at comments. I need a nap now. Okay. We don't want that. I could just give us a little bit of time after this. Refreshed, nice. So relaxed. Just what I needed to be here now. Oh, thanks, Ellen. And welcome, Ellen. All right. So that's a practice that, in the beginning, I thought, oh, I don't know if I can really do this. Will it really work? And I have to say, after, practicing that muscle, as Mark was saying, over time, it really has become just a natural way and regular way of being to really bring myself back or prepare to enter a space with someone. And it's something that you all can do. Centering, yes, centering. So presence and centering. Why are these skills the most important for trauma impacted individuals?
You don't want to do something to re-traumatize. If you're
No.
anxious or not responding in a proper way, it could re-traumatize that person.
Right, right. Don't want to re-traumatize. Thank you,
Or
Sylvia.
when they're triggered, how they act, because people, once they're triggered, they go through the same emotion that they did when they were traumatized originally. And if they're not able to have some type of calm down skill, they stay with that cortisol level way up and still in fight or flight mode. When the situation is not dangerous, it's just a reminder of the danger.
Yes, yes. So calming that downstairs brain. If you'll remember the conversation in the video around, the only way to really get that person, centered is to work on that downstairs brain by calming the brain. And that's exactly what this does. Thanks, Andrea, for that. Any other thoughts around that? About why it's the most important around trauma impacted individuals? Consider when you are not present or centered. When is that? When are we not present or centered?
You're looking at your phone, you're turning your head and watching something happening next to you. The person can sense it. The person can sense that you're not there for them.
Yeah, exactly. We're engaged in something else. And you're right, Celia, it's obvious. It's obvious to the person.
It's interesting. There were so many different stories about being in the ER in the hospital. And what we heard from several people was that they weren't present for me. They didn't even acknowledge I was there. And just noticing how that feels.
Thank you for that point, Mark. How do you find presence and center? Any other ideas out there? Things people have done that they find works for them?
I can say that the only times that I feel really present and centered, it's usually not when I'm working with others. It's when I'm like, just let go of everything. And one time is when I get a massage, and the other time, I was just thinking of the other time and now it's not coming to me. So if someone else wants to go, I'll think of it and come back.
Another thing that we learned was called tracking.
Tracking?
Yes, and that's to be mindful of where you are, how you're feeling, what your body feels like and everything. And just doing that throughout the day to kind of center yourself and then to reground yourself.
Okay.
And I think there's an importance when you look at this from a health equity lens, is the implicit bias that we bring to a particular situation, a particular individual you're working with, assumptions that you may make about their culture or their socioeconomic status. We have to be honest with ourselves about our beliefs and have a way to clear ourselves so that we're truly objective, that we're open, and we can develop trusted rapport with the other person.
Yeah, that's such an important point around the equity piece, right? And addressing that as well. I'm looking also at the comments. Terry says prayer and meditation help with centering. Andrea, aromatherapy and prayer works for her. Walks in nature. Sandy saying walks in nature and being outside. Yoga, meditation, and prayer. Yes.
No, another thing is that I know we talk about the Zoom meetings and the pandemic and how it has affected us and challenged us, but it also made us realize that we have to have a time to ourselves. You know, when everybody is stuck in the house together, that how do you take a minute for yourself and focus and be mindful and center yourself so that you don't kirk out on everybody in the house, you know. So I think there's some good things to the pandemic too, because it's made us learn some things and have quiet spaces in our own homes.
Yes, because sometimes that's the only place we can be, right? In the early days of the lockdown, that's where we were, you know, stuck at home. And so trying to find those peaceful places where we could do centering and be mindful.
Val, can I be a participant for a second?
Yes, Alan, absolutely.
It's so fun listening to you, and thank you for this amazing opportunity to learn.
And Ellen, would you mind introducing yourself to the group?
Oh, yes. Hello,
also
everyone. Thank you,
presenters.
Mark. So I know many of you. My name is Ellen Kagen, and I'm the founding partner of the Coach Approach Partners and the co-designer of this curriculum. And having been a founder of the System of Care movement, really aligning with people like Mark and Val and Lisa that we've got to change the conversation if we're really going to create systems change. And I will be doing this for the rest of my life, but now we're going to pass it on to my children and our children's children so that they can complete the journey. So I'm so glad all of you are here to, you know, share the wisdom and share your own wisdom around these kinds of shifts that all of us need to make in order to create the changes that need to happen in our world. So this presence thing, gosh, I mean, if I could get outside or dance to music in the middle of my day. And I know in the pandemic, we're home. And so maybe people aren't seeing us so much. So it's actually maybe easier to have those moments. But when I first learned this, it was pre-pandemic. And going back to what Celia said about equity, I had a very difficult conversation that I needed to have with my boss. And the power was differential was pretty clear. She had the power and I did not. And I was extremely anxious. My heart rate was up. My palms were sweaty. I had something I really needed to get off my chest about how difficult our interaction had been. And I was in my office. And I said, I do not want to walk into her office in this state, because if I stay in this state, I am not going to show up my best self. Anybody ever been in this kind of situation where you just know what I'm talking about, right? So I literally focused on the soles of my feet. I put my feet on the floor. I got very quiet. It was maybe 2 minutes before my meeting with her. I put my feet on the floor, closed my eyes, and really set the intention of how I wanted to show up. I lowered my heart rate through my breathing. I found that I went to a more neutral emotional state, and then I went into the meeting. A third of the way into the meeting, I could feel myself getting anxious, like it wasn't actually going the way I wanted it to go at that moment. And you know what I did? I focused on the soles of my feet. And I didn't even have to close my eyes or, go into some deep meditation. Just by touching my feet to the ground, I was reminded of how I wanted to be present and centered and showing up in the way I did. So I wanted to share that with you because I haven't thought about that in a long time. It was about 6 years ago that happened. And this presence thing is no joke. If we don't show up in the way that's our best self, the rest of it isn't going to go well. So thanks, Val.
Oh, thank you, Ellen.
So with this, we're going to go further into the skills. Now, if we were going to be doing this training live or live virtual, the full training, it's about 16 hours of work. And how we really do this training is the information is great information, good slides, valuable, and it doesn't kick in until you practice. So how we really developed this training, especially in the virtual world, is after each one of our skills, we go into table work or dyads so that we can really practice and not jump ahead. So when we talk about listening, it's really about listening. How can engaged listening be trauma informed? Good question, because when we think about being trauma informed, we're responsive. We're with the people. We're at their level. And engaged listening is where we need to be. There's other types of listening. I think I was listening to a podcast. I think they had like 16 different types of listening. Way too many. We break it down to 4. Engaged is where we want to be. And then we have a couple of others that we utilize all the time and may not be the most effective. I can say one's definitely not the most effective. When we think about listening, we have these 3 ways of listening, ways of interacting that we use a lot. First one's called the fix it. How many of us are asked a question and we respond? Here's the answer. This is the way to go because it works. Human services, family members, systems. We're fix-its. That's why we're here. We want to see people get better. And yet, if I put my solution out for you and it doesn't work, I've lost credibility. And if I'm just putting that solution out, that fix-it piece, I'm not allowing the other person to develop. So we have our fix-its. We have our self-referential, putting ourselves in the situation. Someone's talking to you about a trauma that they went through. Maybe they were abused or something of that nature. And if I'm talking to that person, I know exactly what you're going through. Oh, it's horrible. I know what you're going through. We're taught empathy as a good way of interacting. I'll challenge that to say, if I say, I know exactly what you're going through, if someone said that to me, no, you don't. You have a thought, maybe an experience, but it's not me. So you do that idea of self-referential. We're putting ourselves into with our thoughts and our patterns, our history. We're trying to relate, which is good, yet we're not giving them the full opportunity to really sit back and listen. And then we have our worst one of all, our superficial listeners. They're on the phone. They're typing. They're doing emails while you're trying to talk to them. They're not there. I'm one of my biggest challenges. My team and Ellen and Val and Lisa and my staff, I think Crystal was on here. Yeah, Crystal's here. She can acknowledge it. So if I'm not present, if I'm not listening, let me know. Tell me. Because that's my accountability to them. So this idea of this superficial listening, it hurts. So if we are doing it, we need to be aware of it. So one of the things that was actually just said, and I'm like, oh, you must have seen the slides, but it was a little bit different. So we think about this idea of engaged listening. We listen to understand rather than to respond. We listen to understand rather than to respond. What is it they are saying? And just let it sit. And in engaged listening, we use the power of silence. We use the power of silence to listen, to understand what's being said. We're putting distractions to the side. We're being aware of those internal thoughts. And I'll even say, someone said the word bias before. We're understanding in that what we're holding, what our judgments are. And we're really trying to refrain and notice that if we're putting that bias out, or if we're having these internal thoughts, acknowledging it and getting back into listening. We do use empathy and perspective and openness. And the biggest thing is curiosity. Curiosity for them and their challenge, their issue, and not necessarily our curiosity for us in their story, but it's curiosity about them. We listen to what's not being said. When we talk about this idea of listening, 60% of what we say is in our body language. 30% in our face and our expression. 10% in the words. How we say things is in that 30%. How we're toning things, how we're escalating or calming our voice down. We're listening for what's not being said, and we're noticing that. And we may ask that. I noticed this wasn't brought up. Or I noticed your face went really, it looks like you're upset. We are seeing what's not being said. We're watching for the nonverbals. I love this when we listen for what's at the heart of the matter. What is the deep issue? What is the real thing that's there? And we allow the room for emotion and silence. Silence is scary. A lot of us like to fill silence right away because silence is daunting. Yet, that power of silence, of putting a question out, or when that person's talking and they have that pause, don't fill it. Let it sit. Let it sit so that they can really come to where they need to with the conversation. Listening is great and challenging. I mean, one of the first things I did, this was after I took the course, this is well before COVID. I was a horrible listener, so very superficial. So I started all of my meetings, I switched to Zoom and Teams and WebEx and all that, just so that I would have a camera on me. No one else had a camera on back then, but it was for me, for my accountability, to make sure I was listening, to make sure I was being present. So when we really think about this engaged listening, we're looking at this with respect, with curiosity, and to understand what is being said and what's not being said. It's all of the things that are kind of under the surface in listening as well. Any questions on listening? Thoughts? So who has a question on listening, I should say. All right. I think, Lisa, you're going to take this over.
Thank you. So the next of the core skills for the coach approach, clarifying and reflecting. We're starting with presence and engaged listening. And now we're clarifying and reflecting. We're curious. What is it that they mean? Mark talked a lot about that in terms of how we listen and being present. You can move on, Mark. So the key elements of clarifying, and this group has already talked about many of these already. I see some heads nodding. So some of the skills is repeating the person's words back to them as best you remember and asking by restating, did I hear this correctly? This is what I heard. Is this what you meant? And what you're showing is that you're curious, you're interested. What do they mean? Not to what do I think they mean, but what do they mean? Again, listening to understand, not listening to respond. Can't remember, there's a couple of people who have brought this up throughout the whole training. Summarizing key points without adding your own ideas. It's not about you. It's not what you think. It's what they're trying to convey. You want to be sure you really are hearing and you're curious about really what is it that they're saying or not saying. What's at the heart of the matter. So don't get ahead of the person speaking. You're at their pace. It's their development that's important, not you. It's not the speed of your understanding. It's the pace that they are working in. Now, I am guilty of this one. Somebody will start to talk, and I think I know what they are saying or what they mean to say, and I interrupt. Yeah, not so good. And fortunately, I have a few people in my life who called me out gently and kindly and said, it doesn't feel good when you do that, Lisa. And it doesn't. We don't like to be interrupted. We feel like we're not being listened to. So is there anything you're sensing behind the words that somebody is using? Any feelings, any fear, confusion? And you can share what it is you're sensing. You say you're fine, but your eyebrows are furrowed and your fists are clenched. Can you help me? Tammy, I see you smiling around that one, right? Yeah. So our goal is to listen well and to understand what it is that's being conveyed to us. That's more important than our ideas about what they should or what they are saying. It's not about us. Thoughts? Any thoughts on this? This skill, the skill of clarifying. All right, super. Well, we're going to move on to the next core skill, inquiry.
Okay, inquiry. And question is, how might questions be more helpful than answers? How might questions be more helpful than answers? Any thoughts on that question?
I was just going to ask, we're literally asking us?
Yep.
Yeah.
Okay. My thought is, because when we ask questions, it will help the person that we're listening to come up with their own answers. One of the things.
Yes. Yes, they will come up with their own answers. Thanks, Terry.
And when they come up with their own answer, it helps them to own it and to kind of pull some from their resiliency and allow them to be prideful that, hey, I thought this through myself.
That's right. That's right. Absolutely right. It's something that they came up with. It's theirs. They own it. They own that.
I was thinking something similar, Andrea. It activates their thinking ability. So get some thinking.
Yep. Yep. That
Or
critical.
as Mark said, it works their thinking muscle.
Mm-hmm.
Yeah. That's right. Terry wrote in the chat, it builds confidence. Yeah, it's that critical thinking piece that's being developed, right?
And
So,
I think this is similar to when you think about wraparound and you think about how do you get to the needs, right? And not the surface, but when the child and family teen asks certain questions to really get to what the child's and the family's needs are. And I think that it's similar in this process.
Mm-hmm.
I see a comparison.
Yes, yes, right. Wraparound is an excellent example of that because it's about what is going to work for that child, that family. Exactly right. Yeah. Okay. Oh,
So-
Tammy, I'm sorry. I said, all right, Tammy, not Tim. Thanks, Tammy, for that.
I just want to put this thought out there. I think it was Lisa or Val had said this in the very beginning that the coach approach model is not something that is brand new. We've done this pretty much all of us to a degree. We're just kind of putting it together in a tighter package. And the reason I say that it's something that we do is I was a juvenile probation officer many, many years ago, and I had a supervisor that was getting close to retirement. And whenever I would go into his office with a case assessment or something like that, and I was trying to determine what to do, I'd say, what should I do? His comment pretty much was a question back. Well, what do you think? And I would give an answer and everything else. That sounds good to me. My assumption years ago, jumping the ladder, well, he's getting close to retirement. Some of these cases could be a bit controversial. So if it's Mark's idea, I'm just signing off on it and I've got no responsibility. The reality in looking back, he cared about me. He knew I knew the answer and was being too reliant on him. So by just asking those questions, I was able to develop it. And eventually, I knew whenever he was going to come see me in the office, or I was going to go see him in the office, he was going to ask the same questions. So in order to expedite things, I come in prepared. Plan A, plan B, maybe plan C. Here's how it is. This is the one I want to go. Agree, disagree. And it got to the point where it was so quick because I was more prepared. So as we think about changing the conversation, this is where we're going to be, where we have people that are coming to us with more answers. And our job gets easier.
Yeah. Yeah. Thanks, Mark. So powerful questions are powerful if they do these things. If they are real questions rather than advice in disguise. And they come from sincere curiosity and respect. Again, curiosity I know has come up a few times. So important here. They're not leading to a particular outcome, an outcome that perhaps you would like to see. And they invite the person to reflect upon, what's at the heart of the matter. Remember, we mentioned the heart of the matter earlier. Helps them get to that place. You can. And the questions often begin with what and how. what and how. As opposed to, next slide, please. Yes, no questions, closed kinds of questions that don't really invite any elaboration. Why questions? Now, why questions, and I know this is true of myself, it can really invoke a defensive kind of reaction to the question. Because when you ask why, it's in a way we're asking the person to defend themselves or defend their decision, defend what happened. Well, why did you do that? And so there are better ways to ask those questions as well. Like, well, what options had you considered as an alternative to why? Or what was your game plan when you took that particular step? Okay, so not off-putting like a why question can be. Questions that you know the answer to or are using to steer the person to a conclusion, right? Don't you think that that car would be a better fit than that other raggedy looking one? You're really trying to steer that person in the direction of a car you think would work for that. Or, wouldn't it be better if, again, inserting what you would like to see the outcome to be. You have an investment in that person's outcome, so steering that. And underlined here, their good thinking is more important than your good question. Their good thinking is more important than your good question. And there may be comments that I haven't been looking to see. Okay, open-ended questions. I love when my staff come to me and tell me the answer, then ask the question. Right, they already knew it coming in the door, right? So here are some great coach approach questions. What have you tried before? How did that work? What is one thing that you could have done, or could do rather, that would have the biggest impact in the situation? As you hear yourself describe the situation, what is coming up for you? What is the most important outcome for you in this situation? Next slide, please. Some other questions that are great coach approach questions. What would success look like? What could go wrong? How will you deal with that? What is most important for you in this situation? Another getting to the heart of the matter question. What changes might you need to make to help make this happen? How would you like this work relationship to look? Inviting that kind of thinking. Any thoughts about inquiry and asking good questions? And by the way, Mark just put a file in the chat with examples of great coach approach questions. Thanks.
And Val, if I can kind of put a comment in the room, I think the other thing that I have found in using really, really good questions, the shorter the better. And meaning, like, what could go wrong? Or What's another one? What's at stake? When we ask shorter questions, what does that allow the person who's hearing the questions to do?
Maybe give a short answer.
Possibly. Let me reframe it
Ask
a little
questions
bit.
themselves.
Ask additional questions? Absolutely.
Yeah, repeat the question to themselves.
Gives them time to really understand the question. And the other thing that when we ask these questions, and I'll say without a bunch of framing around it. So if you're talking to your child or something and you're trying to get them to go to therapy, if you're being really succinct in your questions to drive it only around going to therapy. So I'm asking questions, say, so why, or what is the challenge with you going to therapy this week? Trying to get them to ask a question, but when you ask it in that much detail, they're really only thinking about the therapy for this week. That's the response that you're going to get. If you just brought it back to, what challenges are you seeing with going to therapy? You're now opening it up to, it could be, I don't want to go this week. And it could open up to something totally outside of your perspective of what you were thinking, just by letting the person interpret what the response might be. That makes sense. I'm seeing some head nods, so. Any other questions?
Mark, I'll just say that when I was studying to become a certified coach, this was the hardest skill to learn. I'm such a helper, you know, I have such vast experience, you know, and you really have to let all of that go to open yourself up to asking questions that you really don't know the answer to. And allowing, I think is what Andrea said, is like get that critical thinking frontal lobe kind of kicked in, so that we can learn how to do that, you know, better. Yeah. And so I encourage, you know, this is really, talk about presence being about a practice. This is really a practice. You got to really turn off your fix-it brain to get to these really good what and how questions.
And I think even adding to that, the other person that created the training, Beth Greenland, when we went through this, she put something out. I'm like, well, maybe we'll see. Her comment was, if you are truly engaged in listening and present, the questions will come. The questions will come if you're there. You'll figure it out. And you're going to ask why questions. You're going to do questions that are leading to an outcome. The new thing that may happen is you're aware of it now. You'll notice when you do it and give yourself the opportunity to either reframe it or let it. That's it.
Pat, you have a hand up.
Yeah, I wanted to say that one of the hardest things for me was always trying to solve people's problems. You know, I just wanted everybody to be happy, joyous, and free. And so let me solve your problem. Let me tell you what you should do, you know. And I find out that the more you allow people to come up with their own, you know, answers, their own reasons, and let them talk and let them vent if that's what they need to do, that they come up with their own solutions. And when they come up with their own solutions, they're more apt to do it. you know, they're more apt to follow through.
Yeah.
And, you know, the other thing that I learned was that, you know, using motivational interviewing, using open-ended questions and affirmations and summation is something that you have to work on on a daily basis. It's not just a technique, it's a everyday or part of your life, I guess I should say. So if you make it a part of your life when you go to talk to somebody, you know, and to listen to them, you're more apt to use it because it is a way that you know, you use it in your everyday life. So now you know how to do it. But thank you, and I appreciate all that you've been saying here too.
And I have a question about how our system of care is transformative when we're developing and working and evolving our system of care. So on a systemic level, how do you see this embedded? Do you see it like family support partners, family navigators, care coordinators? This approach is about sharing power.
Yes.
It's transformative. So how can we use this to have shared power and shared responsibility? In what ways where do you put it?
Celia, that is an excellent question and revelation in terms of that. And I will share that in Philadelphia, when we piloted this with family members, some of them did work in, you know, as peer support partners and advocates with families, some in wraparound, some, you know, as advocates. And it was transformative for them when they went back and worked with their families.
Mm-hmm.
And they, you know, and they admitted it was hard at first to, you know, like, I want to, you know, sit at that IEP table and, you know, do it. When they followed the coach approach and they allowed for that parent or family member to ask their own questions, to really come to their own solution around a particular problem, then they were there for support.
Mm-hmm.
However, that parent was able to soar and take it away and be just fine in terms of, you know, how they wanted to show up and what they needed to say to advocate for their child. And they were just, yeah, it was transformative.
Mm-hmm. Thank you.
Yeah, and Celia, you know, the coach approach way is like, well, what do you think? You know, if you're going to ask us a question, you know, let's unlock it. You probably gave half the answers. You were like even asking your question.
Because I see this as, you know, I remember the very early 2000s, there was a publication at one of the systems of care conferences on how the role of a psychiatrist changes when that psychiatrist starts working in systems of care. And I think this is the same way. It has to do with equity. It has to do with respect and getting rid of your implicit biases to be able to be present. And I think it's part of our evolution in our system of care, what we're trying to accomplish. And that means everybody is working towards this goal. If it's the care coordinators, they need to learn it. You know, if it's whatever model you have, and if you bring it out to your partners, because the system of care is interagency, that's transformative. Oh my God, right?
Yeah.
If you start embedding this in other youth serving agencies, you have a transformation.
Yeah, I'd love to put a little plug for tomorrow for another session here in this conference where amazing leaders, Janice Schutz from Washington State, and Val from Pennsylvania, and two of her family leaders, Benita and Adamina, as well as Mark from Pennsylvania, are going to really share exactly the examples for your questions on how using this can transform a statewide family organization, transform a family organization and transform a system, as what Mark has done in Pennsylvania.
I look forward to attending.
Good. I think it's at noon. Is that right, Mark?
Yeah.
Yes.
Eastern, no, noon Eastern.
Yes. So we'll look forward to seeing you there, Celia, and others here.
Yeah.
Yeah. We'd love to have you. Thanks for the plug, Ellen.
All right. So
Okay.
watching our time, and I want to give adequate time for this too. So the idea of feedback. So when we think about feedback, we are giving feedback that is supportive. When we look at feedback, we look at this idea, it's how can we apply what we know about the coach approach model and being trauma informed in feedback. More of a kind of a hypothetical question in it, because there's no one way. Because if you remember back to listening, we're meeting them where they're at. And with feedback, we are using this as a way to help people be more effective. We're speaking what is happening. You're telling them this because you want them to succeed. And if you said that to some people, I'm telling you this because I want you to succeed. I believe in you. You did a great job. Some people are going to take that in, love it, just bring it in. It empowers them. It energizes them. This idea of positive feedback, being supportive. They love it. They need it. We call them ferns because they can take as much good, positive, loving feedback as you can put out. Just live on it. And then we have our cactuses. Your cactuses are the ones that don't need a lot of feedback. It can be really succinct, short, and to the point, and it is just as meaningful as a person that needs a lot of that watering, that fern for feedback. When we think about this in a trauma-informed approach, we are being truly aware of what we know, what we think we know, that bias, that opinion, and holding it very, very lightly to gauge the feedback that's needed in the moment. We're trying to give mostly positive feedback. We call it the 80-20 rule. We don't do a sandwich, positive, challenge, positive. We try to overall celebrate the success, provide observation. I'm seeing this. I saw this. You said something this way. Not judging the person, you're looking at the action. And that's where you're providing that feedback. So, or you're focusing on the behavior and not the person or their personality traits. You're being very sensitive to it. And you're making sure that you're clear, that your feedback is correct, that it is, you're setting those expectations to move forward. What would you like to do differently next time? It's a great question. It's about, it kind of brings the person back to where they're holding responsibility for this versus where you're going to hold responsibility for them. The other thing with feedback is it's got to be really timely and specific. Instead of, you did a good job, Val, talking about inquiry. Val, the way that you presented inquiry was succinct, on point, and you got the message across. It's a great job. You can see the difference in feedback. One is interpretive and the other is really specific. We're trying to be specific in our feedback. How many of us get enough specific feedback? I'm seeing some head nods of no. Yeah.
Maybe raise your hand if you do, because
Oh, yeah, raise your
we
hand,
want to
yep.
meet you. We want to meet your people.
Yep. Yeah, we don't get enough good feedback. And it's really got to be timely. And that's where it makes the most meaning. Lisa.
All right. So we have feedback, and then we move into accountability as another of the coach approach core skills. So accountability, think about this as collaboration, right? That together we're going to come up with the next. It's not from the top down, but together we're going to come up with what's the goal, what's the plan, how are we going to be held accountable, and it is going to be the we. I'm going to be accountable to support you, if that's what you're asking for. You're going to be accountable to whatever you agree to be accountable to. So it's a collaboration. You could move on, Mark. So what we're talking about in the coach approach model, is that we're supporting the individual to feel safe, seen, and heard. These are our conversations. We're committed to developing a choice and options in others, for them, with them. And we're supporting by giving feedback, by listening, by asking questions. And we too are committed to being there and supporting our coachee or our family member, because of all of this also works in our personal lives, with our families, with our friends, with our loved ones. And we're going to hold each other accountable. I'm going to agree. And together we're going to agree. So we've talked a lot about these core skills. We haven't really shown you the process model yet. So let's take a look at the model. This might make a little bit more sense. So we talked about the core skills that start with presence, managing our biology so we can truly be there. You know, that mind that we saw early on that has less distractions in it. A muscle to be practiced, as Mark always reminds us. And then we're engaged in our listening process. We're there to hear what it is they have to say, not to respond, but to be curious. We're asking clarifying questions. We're inquiring. We're giving feedback, mostly positive, 80-20, 80% positive, specific, that can be heard. And then we're talking about a plan and accountability together. So take a look at this model. It doesn't always look like this. And it doesn't always work precisely like this. It can be 5 minutes. It can be an hour. But mostly, this is the model of the coach approach. Establishing presence, clarifying the focus with all of our good listening and questions, identifying the goal, creating a plan, what next, and together gaining some commitment on what's going to be done, which is anchoring and accountability. What is it that is going to happen? And how can we support you? Curious? You're just saying this for the first time, but we've been talking about it for a couple of hours. How does this sit with you? How does this sit? You thinking about when you look at this? Tammy says, I love it all. This throws me a little. This throws you a little. Can you share?
I'm just I think for me, no, I like visuals, so this is good in that sense for sure. And I love the colors because that's helpful for me. I think I would have to somehow take some of the verbiage and hold it, that anchor accountability. And I guess certain words I have to pull in with the earlier, I guess, screens you shared. You know what I mean? So I would just have to go through, I would have to have this and then go through it again and again and again. That's all. I just would have to go through it, like, in other words, so I would have to say the presence, take it back and then focus on that again in this picture, and then take that other clarity and then pull it back into this picture. I just needed to connect a little better. That's just me. That's all.
Thank you. I understand. I too am a visual person. And so I hear you taking all the pieces and parts that we've talked about for the past couple of hours and trying to lay them into this, and it takes a minute. Did I get that right? Super.
A little reflective there. Thank you. Yes.
You're welcome. Like you have something to say, Laurie.
Similarly as well, but another thought that is coming up for me is when I do work with families, and I think I do some of this somewhat, not all the time. Some of it I've actually seen I need to work on and improve on. But what happens with families often is that they'll have one goal when you meet with them, and then when you go to meet with them again, they've totally forgotten that goal because something else has happened, or they get distracted. So it's something new that you have to work on. So sometimes it can be like bouncing all over the place. And is this difficult to do if that happens? I mean, are there strategies? That's what I'm thinking of. Those thoughts are going through my mind right now.
Can I respond?
Sure.
So I heard you say two things. One was you're working with families and their goals are changing. And in a separate way, there's another part of it that we talked about, the difficult to respond to some things because things are always changing. So we have two roads. Okay, go ahead.
That's true. But also the fact that they don't want to work on the original goal anymore. They want to do something else as well. So
okay,
giving families voice and choice as well. I mean, that's an important piece to keep in mind for us as family peers.
Okay, so it's the goals changing is one way, one road to go down, or the other road to go down is the kind of chaos in the community, why things are always changing. So if we were to have a conversation, which one of those is more important right now?
And so I would ask them that question. Which one? I mean, I would have to bring up, well, you know, you wanted to work on this goal and you're finding it. For me, I would answer that for my own self, it would be the distractions in the community. Because when I set goals, I'm always finding myself having to go back and rethink my plan if my original plan isn't working.
Okay, so that's what's important right now. So that if we were in a coaching session and that's where you wanted to go, I'm going to put this one to the side and I'm going to work with you on that.
Okay.
So I think you were actually getting that to the family to say, well, your goal changed. Tell me about that.
So let me just point out that that is some of what's coming up in the chat.
Okay.
Right? It's okay to have new goals. Let them tell you the priority. or the goals change.
Yeah. And I'll add, if you're working as like a family peer and you're working, let's say, with child welfare, and they have something that is set in stone as a goal, you have to address that. It can't just be thrown out. Yet, it could be coached into what's going to make that happen best.
So, and then that all sounds great. I like that. But if the goals are constantly changing, like you're constantly going back and relooking at things, and also, or they don't want to work on that anymore. And then there's the excuses. I'll do that when this happens, or I'll do that when this happens.
Yeah, I'd like to jump in, Lori. I mean, I think many people, and that, or I'll let Pat go first, but it's not an uncommon. You're putting out something I think that's resonating with a lot of people in this room. Pat, why don't you go first, and then I'll pick up where you, after you.
Well, I think if you could go back to your other slide, if you don't mind.
Yep. I think. Yep.
So for me, I feel like we do this as family support partners or navigators or whatever. You establish your presence. Who am I? Who are they? You listen to their story. Then you ask different questions. So that means that you're clarifying the focus. Then you identify the goal by setting a vision for them, and there are different ways and different things that you have to do in order to get to their vision. And then you create that action plan so that if other things come in, you can easily put that in there, or you can say, listen, let's talk about this. What are the priorities? Let's take 3 at a time, and then you get the commitment that they're willing to work with you and you're going to work with them. I just think it's a coach approach, which we've kind of been doing it, but we have it in different words. And we have to, think about, are we doing this and how we're doing it? Because maybe the reason why the person is constantly changing is that we never got to really what their goal was in the beginning. And things happen to family, yes, but it doesn't mean that they always change their goals. Sometimes we just have to adapt new strategies because the pandemic hit. Who would have known? So we had to change everything around, so I think this is doable. I just think that it's not familiar in the terms that it's in.
Yeah, Elizabeth. Thanks, Pat.
Yeah, I want to follow up on what Pat just shared to say, yes, like when families are in crisis, I think it can feel chaotic to us as well as we're listening. And so identifying the goals can be tricky. Like, I think, creating that vision, initially it's challenging if the chaos keeps coming, and then with every meeting it seems like maybe there's a new problem that's being presented because the family's whole system is sort of in an unstable place due to the crisis. So I think maybe that's the challenge that we're coming up against sometimes, and it just maybe comes back to listening and really like that clarifying the focus piece. Yeah. And as Pat was saying, if you have a family vision, then when new challenges are coming up in future meetings, being able to tie it back to that original vision that can be like an overarching, hopefully like an overarching, goal. I don't know if I'm making sense.
If I hear you, Elizabeth, it's sort of like the North Star. You're moving towards the North Star, whatever it is that the family has decided.
Yes.
Right. And that all things move towards that. And you're what you're doing is you're reflecting how whatever is happening and whatever is they're doing is moving either towards or away from the North Star.
Yes. What they see for themselves in that way.
Right.
Yeah. But I think it's just hard sometimes for families to really get a sense of where that North Star is when they're in that crisis mode. So, that's where those questions that we're asking can help, guide, but not in a very open-ended way, so, but just helping, ground them back within what they see for themselves, what their their goals are ultimately.
You're spot on. It's their goals. You're helping them discern their goals. What's the most important to your family?
Yes.
You got it. Ellen.
Yeah, so all of this is true. And I want to focus on that orange box for a second, because we're so good at designing plans and goals. And this is what we've been taught. I mean, all good coaching, teaching sessions, really focus on that. And what I found in my practice was that if I focused on the commitment that the family makes or the other person makes, it's their commitment. I can't hold anybody accountable to what I want. It's got to be what they want. Like, you can't hold people accountable for what they haven't committed to. I learned this from my children. I tell them they have to be home by midnight, and they're like, yeah, and they don't come home by midnight. And it's like, whose goal was that? It was mine. So I learned a really, really important lesson to watch my own vision and not get ahead of where my person is, the person in front of me, and really anchor their commitment. And then, Lori, as I was listening to you, my heart was breaking because, how can we support people to be successful? Because success begets success. And really thinking about what's my role as an accountability partner, right? So it might mean more than just, I'll see you at the next session, or I'll see you in 2 weeks, like as is our routine. Really probing, as Lisa was talking about, in what is it that I can do to help you be successful in your commitment? Period. That's what we do. We're partners. So focusing on that orange box has been a real game changer for me as both a supervisor and a leader of teams, and in working with families, to really get my own wishes out of the way about what people would do, and then hold my space as their partner in this process. And I guess the second thing I would say, Lori, just back to the heart, really, I think we all felt it in this room. When there's breakdowns, and there's going to be breakdowns, this is going back to curiosity, which you've all been putting on the table. This is like going back to our questions. What prevented this from happening? What can we do differently next time? Which part of this was the hardest? How do you see it? I mean, there could be a million questions that would come up. I don't know, Lori, if that was additive, but that's where I found myself really growing once I got myself out of the way.
Yeah, it's all helpful. And I feel like gaining commitment from people is probably one of the hardest things that we have to do. So thank you all.
Use of coach approach to the adaptive leadership. What this means is that we use language of commitment and holding accountable for what others commit to. What we were just talking about, gaining that commitment from the person involved. And we use that language so that it's clear. We are seeking feedback from team members on how we can be more effective in our work with them. You know, we may be a supervisor or a manager, however, it's a partnership. How can we do better? And we are consciously modeling adaptive, strengths-based leadership all the time. That was one of those skill sets that was around modeling the behavior. Modeling the behavior. And the coach approach works. Outcomes, results are achieved much more quickly. Staff develop critical thinking skills. They're not always going to be knocking on the supervisor or manager's office. Can I ask you a question? Can I ask you a question? No, they begin to figure those things out for themselves. The knowledge and the skills of the staff are tapped. And staff feel better. The morale is higher when they know, hey, you know, they know I got this, I can do this. That then, in return, results in leader stress being reduced because the people answer their own questions. What I was just saying, you won't have a line to your door, you know, or waiting for you when you come in the morning. And it is aligned with system of care practice, which, you know, you're all, for the most part, in system of care. And it is very much aligned with that. And it models the trauma-informed approach.
So I looked at our time and I think that we have time for the video. I heard a couple people say that they were really visual learners. So we want to pass it to Lisa to introduce Kevin and Monica.
Okay, great. So this is an unscripted conversation. This unscripted conversation, Monica on the right is a person who works at an organization that supports people with developmental disabilities. And what I'd like you to do is I'd like you to take a look at what Monica is doing and what she's not doing in this conversation. And what impact do her actions have on Kevin? And what can you tell about their relationship from this conversation? So it's about, what, 2 minutes, Mark?
I say about 5, and you also note that Kevin is actually also a resident of Intellectual Disabilities House. So,
thank you.
Want to get more interaction with family and friends.
Oh, so you've been thinking about that, huh?
Yeah, my family. Yeah.
So what have you done so far?
I called them and seen where I can go see them at and when I can spend time with them. I'm thinking about the summertime.
Thinking about the summertime?
Yes.
Okay. And have you called, what, just one family member or
Yeah,
2 family
I'm
members?
going to call my sisters and my mom and my nephew. I've been talking to my nephew and my nieces now. My niece, I saw one of my nieces already though. She come up here for me.
Oh, so it's already worked for you.
Yeah, I saw one of them. I just didn't see my oldest niece. I didn't see my oldest niece yet.
Okay. How did you go about doing that?
I called my mom. My mom come up there and saw me, and my mom, my sister Nicole, and my foster dad come up there and see me. My little baby niece. Baby niece is like 3 months or 2 months. She's cute as a button.
Oh, well, congratulations, Uncle.
Yeah.
So what did you need to do, or what else do you need to do to get in touch with them?
I need to call them and try to schedule a date to see them. Yes. You guys tell me all the time, but I keep forgetting to do it.
Oh, okay. So what can you do to remember to do it?
I need to get an agenda, write down an agenda, I think.
Oh, to write some things down.
Yeah, take agenda or make it like flashcards, something like that.
Okay, does that work for you?
Yes, flashcards work more because I get to see the pictures and it helps me mind me stuff because I can't read very good.
Wow, what a great idea.
Yeah.
So what are some other ways you could do that?
Other ways I can go about looking how to make flashcards on computers or digital flashcards or just mental flashcards.
Nice. Oh, wow. So you have a lot of ideas of how you could remember to get in touch with them.
Yes.
So what are some things that you could do to get them more interested in seeing you?
Show them pictures of me on Facebook.
Send some pictures, yes.
Send some pictures. Tell them I miss them.
Mm-hmm.
Tell them I really love them. I miss you guys very much.
Great ideas.
All the time.
Wow.
And probably show them pictures of me getting more active in the community.
Oh, that would probably do it.
Yeah.
So how would you go about doing that?
By showing them how I'm working and how I'm trying to save money to get see them. And showing them how I grew in my lifetime. Yeah.
And how would you, you said you get flashcards, you said you could do Facebook.
Yes.
You could go on the computer and send them messages.
Yes.
Well, you came up with a lot of options, so how can we get started on that?
I have staff help me, or I can try to do it myself a little bit.
Great idea. Wow. Okay. So when do you want to get started?
Anytime.
Anytime.
Yeah, anytime
Sounds
I can.
good. So how can we get started?
By
Like today is today, tomorrow, when?
we can get started as soon as possible.
Okay.
Because I don't know what day to get started yet, because I have a lot of work to do.
You got a busy schedule.
Yeah, I do have a busy schedule. So I'm thinking about on the weekend trying to go up there and see him one day.
Okay. So you mentioned that you wanted staff to support you. How would you go about letting them know?
I was just gonna ask the White if you don't mind taking me up there, or don't mind trying to get some schedule for me to go up there. Because I say you don't mind.
Yeah.
You already told me that once. You said you don't mind driving up there, or having some way I can get there.
Wow.
Or I can just message Nicole because she lives closer right now and try to get up there for all my family. That's what I'm really trying to do.
Okay.
Yeah.
So you can let the staff know, and what else? Let Mr. White know?
My Mr. White know and try to get and let my house manager know, Mr. Urban.
Oh, yeah.
And then I have to talk to my sister Nicole, let her know because she lives closer to me.
Wow.
So that would be easier for me to get to my sister Nicole. And he's not here. Then later on, one day I get to see my grandma out there. My grandma lives too far away.
Okay. Is there anything else that we can do to help you?
Yes.
What would that be?
He'd help me by supporting me.
Okay.
Do what you always do, support me and keep me calm I do get to see my family.
Keep you calm. So you're concerned about that?
A little bit.
A little bit. So what can we do to help you remain calm?
Let's be yourself.
Just be
have yourself. Yeah. So when I see you guys happy, it makes me happy.
Great. I'll let them know that.
Okay.
Okay. Anything else you'd like me to do?
Yes. I like you to be yourself. Be your happy yourself. Yeah.
Try to do that very well.
Okay.
Okay.
Okay. Thank you, Ms. Monica.
All right. So some reflections. What did you notice Monica doing? What was she doing? Engagement. Engagement. How was she moving through engagement? Celia, I see you talking, but I can't hear you. You're on mute.
I said she was very strategic in how she asked these open-ended questions to allow him to come up with the answer, to come up with a solution, come up with works for him. And then she reiterates in like a reflective listening that this is what he wants. And so she's empowering him and he's developing his plan and he's saying what he needs from staff. So I thought that it was a very respectful way of working with him and honoring his decision-making.
Beautiful. Well, what impact do you think her actions had on Kevin?
Well, it sounded like he has maybe trouble staying calm. You know, he mentions that at the end, and her body language, voice, the tone of her voice is calm. She's creating safety for him. and a peaceful environment, and he is able to interact in that environment.
Absolutely. You could feel the calmness between them and all of the nonverbal ways that she was communicating with him.
And her tone of her voice, not just what she was saying, but how she was saying it, created this serenity kind of that he could participate in.
Great noticing. I see some other comments in the chat. Some really great comments. Let's see. She also had a very comfortable feeling to her voice and body language as she was talking, empowering him to think. Oops, I lost the chat.
She was mirroring his body language, and her posture was calming.
Yeah, almost 75% of communication is your body and your voice. Your voice, right? Did you notice her voice? She was just right there with him.
And somebody just said that she let him define what as soon as possible meant, define how to get in touch with them. He was the driver.
Yeah, everything was clarified.
Mark, I know we're going to move on. Thank you.
All right, yeah, looking at our time and knowing a couple minutes out, we want to get through a couple more slides for you and just get you some the kind of more open where we see ourselves going and what we've done to get there. So one of the things that we want to just bring back now is, if you remember, we in one of our first slides was this trauma-informed principles and the coach approach. So remember the safety and trustworthy, transparency, peer support, coaching, collaboration, mutuality, empowerment voices. What we did was actually crosswalked. So we see that idea of safety. In the coach approach, we're looking at safe, seen, and heard. Transparency and trustworthiness, being present, responsive, that idea of certainty. We're supporting people, we're listening, we're more discussion and more dialogue in that idea of collaboration, bringing people together, encouraging and building them to reach out to new networks. We support empowerment and ownership. It aligns with that empowerment, voice, and choice. And then the cultural and historic lens. We are honoring the individual. We look at this as this individual as their who-ness. It's who they are, and that's really what we work with. It's their culture and history and their work. And we work with them at their level, at their need. And that is our job. So, I missed the slide here. I think, Lisa, you were going to talk about how trauma-informed supervision.
Yeah, I'm covering.
Val, sorry.
Sure. All right. So Fredla developed 10 keys to effective trauma-informed supervision as part of their family peer support training. And they are to support individual growth, unity with your team, feedback to self and others, expect growth, build accountability, reinforce potential, instill autonomy, share continuously and provide certainty, optimize ownership in your people, and build and reinforce relationships. Does this ring a bell and what we've been talking about, right? Words like accountability, reinforcing potential, ownership of what people do, giving feedback, positive feedback, growth. It's all about promoting growth in your people. That's really at the bottom line of this. And so this is very much aligned with Coach Approach, very much so.
All right. So with that, I get to close us out, and I'm going to give a little bit of opportunity for some questions at the end as well. So we'll go through this at a little bit of a pace and stop me with questions. So when we decided to work with Ellen and do the train the trainer and with the Coach Approach partners, we wanted to look at a longitudinal study to actually see, is the Coach Approach model making change over time? So right now, this number is actually maybe a little bit low with when I pulled this data, we had 581 people that we've trained in Pennsylvania, and we have 426 in our evaluation. So it's about 30, it's probably actually about maybe 32 of our 67 counties. So Pennsylvania, we are a system of care state, yet not every county is system of care, and Pennsylvania is a great state because every county is its own kingdom. So very independent. Challenge with communication. And then Val has also done some great work with training some family members in Philadelphia. And we actually just got done a Coach Approach for youth and young adults this week, I think, maybe today.
Yes, we did.
So that's another thing that we're doing that's actually not in this evaluation. So what we did was we actually partnered with the Youth and Family Training Institute, who does our high fidelity wraparound data and evaluation, as well as my grant evaluation. And we actually do a pre-post, a 30-day and 120-day survey. We're working on getting our 120-day numbers up, always a challenge. When you look at longitudinal pieces, yet we're actually seeing some really good information. So what we have seen from the people that have taken the Coach Approach is this idea. This is what some people have said. So my daughter now takes ownership of the commitments that she's making. So I was a family member that was using the Coach Approach, or being present with my son and not being distracted. He's noticed the change and the dynamics have shifted. So by being there, he's able to, she was able to recognize that. When we looked at some of our longitudinal data, we looked at, this is one of the questions. So Coach Approach training makes people better supervisors and leaders. 90% of the people that completed the course felt that the training was useful to their role. 87 of the respondents after 1 month agreed or strongly agreed that I'm committed to using the skills. So we're seeing people that are taking this, that are using it. I love this training as a young professional. It challenged me to think of leadership in new and not so scary light. Just really good information that we're getting from this longitudinal study. And then so the Coach Approach supports feeling safe and seen. 92% of respondents agreed or strongly agreed the trainers created an environment that was safe and supportive. The trainers did a wonderful job creating a safe and welcoming environment. Their words say it. And then when we also look at our transition to Zoom, this is the thing, and Ellen was scared to death, and so was Beth, our other developer, when COVID happened, because we thought we would have to stop everything. And we tried it. And we actually tried it in Pennsylvania with a group of state employees. It worked really well. And this is the feedback that we got. Love Zoom. It was the best virtual training I've completed. Engaging, insightful, helpful. It was great through Zoom. The breakout rooms were so much better than they would have been in a meeting or training room. That's the one thing that we notice. In a big room, it's noisy. When you're in that table or you're in that dyad, you're there. And we roll on. This is really where we are. We are continuing to run this out in Pennsylvania. I'll be doing another 300 to 400 this year. We're implementing it in family organizations. Coach approach for youth and young adults, just talked about that. We're actually developing a whole entire trauma-informed coach approach training in this upcoming year. Coach approach for groups, and then the work that is really happening all around the country now. And thanks to the great work of the teams. And Val, one my favorite quote.
Yeah, so why is it that we do this? So in the words of the late great Maya Angelou, she said, "I've learned that people will forget what you said. People will forget what you did, but people will never forget how you made them feel." So that's why we do this.
And with that, questions, and thank you all for your presence. Who has questions? Tammy. Oh, it's a hand clap.
Yeah, that was just the same thank you, and that's all. Thanks.
The hand raised.
Well, we hope to see some of you in your states and communities. These are really powerful skills that, as Celia, you said, need to be applied at the system table, at the organization table, in family peer support organizations, and with families. The more we as leaders across the systems incorporate this into our way of being, I really believe we will be able to accomplish what the vision of the system of care truly is for all of us. And thank you for hearing us. I feel the energy in the room. I feel like we just really deputized 35 new champions in this approach. So thank you for that.